We're a team of health professionals. We sit within the locality youth offending team. So our little health team is split into two. So we've got a team that are based in South Staffordshire and a team based in the north of the city. So we cover Stoke-on-Trent. We're a team of nurses, mental health nurses, healthcare support workers, speech and language therapists. And essentially we work to assess the health needs of the young people that come into contact with youth offending services. We help young people who are either at risk of offending or who have committed offending type behaviours. So across the spectrum really, the majority of young people that we work with have some vulnerabilities due to the fact that they've come into kind of the scope of the offending field. And again, we work to address the health needs of those young people. So lots of the young people that we work with can be looked after children or children who have ongoing and multiple mental health needs and not necessarily have the support network around them to help them access health services as they should do. To be nominated for the award is amazing really. We're a relatively new service and we're always developing and progressing and trying to kind of further what we do and the services that we offer. So to be recognised for the way that we work is a really good thing, and I think the reputation that we built up within that service is really, really positive, so I think it's just recognition of that. So it would mean a lot to us if we won.
Projects looking at people who are intense users of services across both community, acute, health and social care. So what we try and do is look at people who either have had an escalating history or a repeated admissions, so that we can look and see actually, okay, what's bringing them back in, what's the catalyst for them to come back in to seek our help and our services. So what we try and do is to meet with them to see what the triggers are that's making them call for help, whether it be them, their families, their carers, and to try and work with them to see if that is always the most appropriate route for that patient. And what we found was a lot of these people didn't realise just how often they'd been in hospital. So when we go to them and say, do you realise that in the last 5 years you've only spent 3 whole weeks at home? They go, really? No, that's not me. It came as a bit of a surprise. I think we just get on with what we do. We were never in it for the award. It's very, very, very nice that somebody thought enough to nominate us, and even more so that somebody else then went through another process and sort of reinforced that. So it's quite an honour to be nominated for something that we just thought was the right thing to do.
A lot of the work that we do is around training the workforce, the early years workforce. We've developed an early communication screening tool, and we've trained half the city last year, and we're just about to train the other half of the city. So every private nursery and every school will get training, and that enables them to identify children at a very early age if they've got difficulties with their speech and language. Nationally, we're recognised as an area of excellence. We're creating new things, we're gathering data for the city, we're actually providing new resources that are so much needed in Stoke-on-Trent. I'm extremely passionate about the work that we do. There is such a high level of need in the area that we live in. We've got lots of children who don't acquire their early developmental skills, particularly around speech, language and communication. The team are really excited. They didn't know that I'd made the nomination, and they're absolutely, I think they're really, really proud of the work they do. We constantly get really positive feedback from all our service users, so this is just the icing on the cake really, to acknowledge the work that they're all putting in